मंजू फ्रॉम एसबीएल एंड मैं आप सभी का वेबिनार की सीरीज में बहुत बहुत स्वागत करती हूँ। आज हम बहुत ही कॉमन प्रॉब्लम जो हम फेस करते हैं उसके बारे में बात करेंगे। जैसा कि आप सब जानते हैं, फ्रोजन शोल्डर, राइट? तो जैसा कि हम सबको पता है कि फ्रोजन शोल्डर क्या होता है एज अ डॉक्टर्स, लेकिन कुछ यहाँ पर ऐसे लोग भी हो सकते हैं जिनको नहीं पता है। तो आज हम जानेंगे कि जो फ्रोजन शोल्डर होता है वो क्या होता है, उसके कॉजेस क्या होते हैं, और नॉर्मली जो हम उसकी ट्रीटमेंट लेते हैं वो क्या होती है, एंड द मोस्ट इम्पॉर्टेंट, होम्योपैथी का क्या स्कोप है फ्रोजन शोल्डर में। सो इसके लिए आज हमारे साथ हैं होम्योपैथी एक्सपर्ट डॉक्टर पार्था चक्रवर्ती। ही इज अ रिनाउंड होम्योपैथ and he is a postgraduate professor in the International PG course of Classical Homeopathy at Lyon University, Bolivia. And he is having a 29 years of experience in the field of homeopathy. He is a former associate professor in the Department of Homeopathy at Lincoln University College, Malaysia, and also served as an assistant professor at BV Homeopathic Medical College, West Bengal, India. And he also having a wide experience in as a speaker in various webinars addressing a range of health related topics. So sir, आपका हमारे एसबीएल की वेबिनार सीरीज में बहुत बहुत स्वागत है। सो वेबिनार को स्टार्ट करने से पहले हमारा कुछ अनाउंसमेंट्स हैं, हम उनको जान लेते हैं कि हमें क्या करना है और क्या नहीं करना है। सबसे पहले, अगर आपके मन में कोई भी क्वेश्चन है रिलेटेड टू दिस टॉपिक फ्रोजन शोल्डर, तो आप हमारा क्वेश्चन एंड आंसर जो चैट बॉक्स है उसमें लिख सकते हैं। और जितने भी अटेंडीज यानी कि जो इस वेबिनार में पार्टिसिपेट कर रहे हैं उनको ऑनलाइन सर्टिफिकेट प्रोवाइड किया जाएगा। तो आप सभी हमारी वेबसाइट पर जाकर अपना ऑनलाइन सर्टिफिकेट ले सकते हैं। वहां पे आपको अपना रजिस्ट्रेशन करना है एंड देन यू विल गेट द सर्टिफिकेट। इसके साथ ही वेबिनार के दौरान कुछ तीन हम विनर्स सेलेक्ट करते हैं। बेसिकली वो रैंडम होगा, जिस और दैट विल बी सेलेक्टेड बाय द को स्पीकर एंड उनके नाम अनाउंस किए जाएंगे। इसके लिए आप जो तीन जिन भी तीन लोगों का नाम अनाउंस किया जाएगा, प्लीज आप अपना कॉन्टेक्ट नंबर क्वेश्चन एंड आंसर चैट बॉक्स में ही मेंशन कर दें, सो दैट इट विल बी इजी फॉर अस टू कनेक्ट यू। इसके साथ ही यदि आप इस वेबिनार की रिकॉर्डिंग या फिर अदर एजुकेशनल वीडियोस को देखना चाहते हैं तो आप एसबीएल का फेसबुक यूट्यूब चैनल सब्सक्राइब कर सकते हैं और ऐसी ही इंफॉर्मेशन और अच्छे से गेन कर सकते हैं। सो नाउ सर, इट्स ओवर टू यू।
Thank you. Very good evening, all of the viewers. Dr. Manju, I'm Dr. Partha Chakraborty. I've been entrusted with the topic, is homeopathy effective for long-term frozen shoulder recovery or not? At the very beginning, I will just tell everybody over here is a doctor or medical student, anybody. I think we are the best persons to heal this type of problems because this frozen shoulder has become a very common disease nowadays. Even today, also in the morning time, when I was attending my clinic, I saw two cases of frozen shoulder. Of course, it should be told in the very beginning that frozen shoulders can come as an isolated case. Only frozen shoulder cases can come to us. It can come to us associated with other problems also. But the main thing over here, the main topic over here is the recovery of frozen shoulder, especially the long-term cases. But I will tell you that cases that do come to us in our clinic, in our outdoors, they don't know whether they're long term, they're short term, but they do come when they feel the pain, when they feel the stiffness, when they feel the necessity that they should take a counseling from a homeopath. And why has Dr. Manju recommended this topic long term? Because this disease is actually a long term disease. So she is very right. This is a long term disease. This can, extend up to 3 years even. So before I start my topic today, I would like to express my acknowledgement to SBL, especially Dr. Manju, Mr. Sharma, Deputy Sales Manager, and the local people over here who actually invited me to take part in this webinar. To my teachers, of course, always when I speak in my webinars, I show my gratitude to my speakers. And especially, I would like to mention the name of Professor S.P. Shengupta, who was the professor of surgery, National Institute of Homeopathy. And I learned frozen shoulder especially from him, how to how to actually diagnose the case of frozen shoulder, because they were actually surgeons, they didn't know homeopathy, but they showed us how to diagnose a case of frozen shoulder. And that is very important because if you cannot diagnose a proper case of frozen shoulder, whether it's a case of frozen shoulder or it's a case of bursitis or it's a case of rotator cuff tears, you have to be very sure what is this case, and accordingly that you have to move. to my patients who have taught me the most and these websites from where I have drawn the references. Now, today's discussion, I'll be discussing mainly 3 points over here. Frozen, because before I go into the exact topic, we need to discuss a little bit about the pathology, about the anatomy of the shoulder, because many of us have learned the anatomy long back. We have managed to forget these details of the shoulder joints. Then the pathology, what happens actually in frozen shoulder, why it is called frozen shoulder. Then the symptoms and signs of frozen shoulder. This is very important. We have to know the symptoms, we have to know the signs, how to diagnose a case of frozen shoulder. And then the most important part of our discussion today will be the management of this problem with our homeopathic medicines. How do we manage these cases in our clinic? So, so our discussion will be revolving around these 3 points. Frozen shoulder, some call it as frozen shoulder syndrome also, is actually the medical term is actually adhesive capsulitis. It can be almost a layman term frozen shoulder. The medical term, proper medical term will be adhesive capsulitis. From this term, it's very much clear that there is something to do with the capsule. The shoulder joint acts like a capsule. As our astronauts go to the space inside this capsule, protected from the outer atmosphere, similarly, the shoulder joint is also protected. The shoulder joint means the glenohumeral joint, which is a main joint of the shoulder girdle that is protected by a series, many ligaments, and that acts as a capsule that covers the shoulder joint. And when that capsule becomes inflamed, there's inflammation over there. That's called a capsulitis. And adhesive means whenever you stick some adhesive to anything, it gets stuck. It cannot be opened. It cannot be, taken out from that particular part. So the shoulder is meant to move. Our hand is meant to move through the shoulder from the shoulder. In this problem, what happens, the shoulder girdle, there is an inflammation of the ligaments. The joints become inflamed, and ultimately the shoulder cannot be moved properly. So it's almost as if the shoulder has been added with some adhesive. So it's known as adhesive capsulitis. It's a very painful condition, and it is limiting the shoulder movement. That is the main thing. The main thing of frozen shoulder is very limited. It's a painful condition which limits shoulder movement, to be very simple. And what happens over here? The connective tissue around the shoulder, I'll show you a picture later on, connective tissue around the shoulder that thickens and tightens, as a result of which the shoulder cannot move properly. Now, it's very nicely defined. This medical condition is defined very nicely by the American Shoulder and Elbow Surgeons Association. And in this definition, if you go through this definition, you'll be able to understand the whole pathology of frozen shoulder. What is it? It's a condition of uncertain etiology. Mind the words. It's a condition of uncertain etiology where you do not know the etiology, characterized by significant restriction of active and passive shoulder motion that occurs in the absence of a known intrinsic shoulder disorder. So the etiology is not known properly. If a patient asks you what is the reason, you can actually assume that it might be this is the reason, but exact etiology is not known. Why it happens? Why does it happen? This frozen shoulder. And it is characterized by the diminution of active and passive movement of the shoulder. We move the shoulder. This is the active motion of the shoulder. But if I move the shoulder with my other hand, or anybody lifts my shoulder like this is called passive motion. This is very important. To understand and diagnose the case of frozen shoulder, you have to understand what is active range of motion, what is passive range of motion. Active range of motion or active motion of the shoulder joint is when the person is moving the shoulder joint on its own, either abducting, adducting, rotating, flexing, extending. What is that? This is called active motion. But if the shoulder is lifted by somebody else, the therapist or anybody else, that is called passive motion. So in this case, both the active and the passive motion gets affected. And there is no definite intrinsic shoulder disorder. In shoulder arthritis, what happens? There will be some degeneration of the bones. In other rotator cuff tears, there will be some tears of the rotator cuff muscles, which can be diagnosed by MRI. But in frozen shoulder, this cannot be diagnosed. This is the definition. Now, this is the picture. Please go through the pictorial representation. On the left side, you can find the normal shoulder joint. The shoulder girdle, let me tell you, shoulder girdle has got 3 joints. The main joint is the glenohumeral joint. And this is a ball and socket joint, just like this, ball and socket joint. Now, this bone, this long bone of the arm, that gets inside this scapula, the flat surface of the scapula, and it is surrounded, just a minute. Yeah, it's surrounded by these fibers. This is a normal thing. This is clavicle, this is scapula, this is shoulder capsule, this is a humerus. This is the head of the humerus. Now, in frozen shoulder, what happens? This capsule, this fibrous part of the shoulder joint, they become inflamed or they become affected and they become tightened. They become tightened, as a result of which the movement of the shoulder joint is restricted. So this is the normal and this is the abnormal pictorial representation of the frozen shoulder or frozen shoulder syndrome or adhesive capsulitis, whatever you can say. Now, diagnosis of frozen shoulder. There is a misunderstanding in homeopathy still now, though it has lessened, that we don't need diagnosis. No, we definitely need diagnosis, because if we cannot diagnose, our management might be mistaken. So diagnosis of frozen shoulder is very, very important. The first point in diagnosis is a proper history of the case. When a patient comes to you, they will tell you that, doctor, I'm having pain in the shoulder. And you have to ask the patient, tell me something more. When did it happen? How did it happen? What are the problems that you are facing? So this history, where it includes the onset of the symptoms. Did it start suddenly? Did it start abruptly? Did it start gradually? And whether it's only pain or whether it's a stiffness or heaviness, what are the sensations associated with the pain? If there is a history of any antecedent trauma or surgery, this is very important also. If there is an antecedent history of trauma, say for example, a patient falls down suddenly while playing in the house with an outstretched arm. If a patient has undergone surgery, after that there was a restriction of movement of the shoulder. So these are all very important factors leading to frozen shoulder. So you have to inquire. The patient doesn't know. You have to ask the patient whether you have any antecedent history like this one. And you have to note the affected side, whether it's the right side, left side, contralateral, both sides. You have to uh, take this. Location is very important. And the duration of symptoms is also very important, because there are three stages of frozen shoulder. I'll come later on. And these three stages actually, they, they have a particular duration, specific duration. And these symptoms, this is a disease whereby you can diagnose the case only by the symptoms or the history given. So after the history is taken, you go and you take a physical examination of the patient, where you see the active motion of the shoulder joint, the affected joint, and the passive motion. I already defined you, but let me tell it once more, because this is very important. This active motion of the shoulder joint means when the patient is moving the shoulder on his own. It can be abduction, it can be adduction, it can be flexion, it can be extension, it can be rotation, anything. That's called active motion. And passive motion of the shoulder is something where the therapist, where the doctor, where somebody else is moving the shoulder and the patient is not participating in the movement of the shoulder. That is called passive movement. This is very important. And specifically, just remember this passive motion, noting the passive motion, the reaction of the patient to passive motion of the shoulder joint is diagnostically important for frozen shoulder diagnosis. Because in active motion disorders, there's a very common DD of frozen shoulder, that is rotator cuff injuries or subacromial bursitis over here. All these cases present to the doctor in the form of pain in the shoulder. But in case of frozen shoulder, the active motion is lost, the passive motion is also lost. When you ask the patient to lift the hand, he cannot lift it properly. He will be or she'll be having pain. Now, when you raise the hand with your own hand in case of frozen shoulder, it will be painful. But in case of rotator cuff injuries, normally passive motion is not lost. The active motion is lost. Passive motion is diagnostically more important than active motion in diagnosing cases of frozen shoulder. In diagnosis of frozen shoulder, I told you history is very important. And by history itself, by physical examination of the patient, you can diagnose the case. Sometimes we advise the patient to go for X-ray. We also advise the patient for MRI of shoulder joint. If it's a pure case of frozen shoulder, maybe nothing will be found, and that is already defined by the definition that I told you earlier. But if the frozen shoulder problem is associated with arthritis, associated with other problems, then some other things can be found in X-ray or MRI. And in some remote cases, some surgeons, they perform arthroscopy, just like laparoscopy, just like endoscopy. They perform arthroscopy, and if they perform the arthroscopy in the video footage, in the video image, they can find thickened ligaments, cartilages. There can be swelling, internal swelling, tight connections, and sometimes even scar tissue. The scar tissue is very important. So scar tissue can also be found in frozen shoulders if arthroscopy is done, but rarely this is done. This is a picture of a normal shoulder joint. Now, causes, precipitating factor, I told you, injury or long-standing immobility following surgery. If a person, in the winter time, we have a tendency to lie on the one side, just with the razai on, we lay on the side, and prolonged laying over on particular side can lead to frozen shoulder. Surgery can also lead to frozen shoulder. Metabolic problems like diabetes, thyroid disorders can predispose a person suffer from frozen shoulder. Hormonal changes, menopausal, this in ladies after 40, 45, when the lady suffers from menopause, they can suffer from this frozen shoulder. And associated diseases of the neck, cervical spondylitis, these are the shoulder, like arthritis of the shoulder arthritis, they can also be responsible in precipitating frozen shoulder problems. Now there are three stages of frozen shoulder, I told you. One is freezing, another is frozen, another is thawing. Now, freezing is where slowly the pain starts. It's an insidious onset. This disease is characterized by gradual onset, not an abrupt onset. It's actually characterized by insidious, slow onset of the pains and with gradual loss of movement. The stiffness is less in this particular stage. Okay, 6 weeks to 9 months is a duration where this freezing stage will be found. Next stage comes when the pain improves slightly, even without the help of medicine, but the stiffness remains or becomes worse. That is called frozen stage. That can, extend from 4 months till 6 months. And the third stage, which is called the recovery stage, that is known as thawing stage, where the shoulder motion improves. Even sometimes it can come to complete normal or near normal, but slight pain might remain. What sort of pain? Whenever you try to wear a shirt, whenever you try to wear a coat, feel some pain. Today, just the last case I saw was a case of thawing stage of frozen shoulder. That lady was not having so much of pain in active and passive movement. Sometimes she was having, but whenever I asked to wear the shari in this way, in that movement, she suddenly had some pain. So this sort of pain, some sort of remnant pain, can be there in the last stage of frozen shoulder, and that can extend up to 2 years. Now, how do a patient present in the clinic? Pain and stiffness, which is progressive, which is insidious, which starts gradually. Then there will be immobility of the pain, painful arc syndrome, this is called. Whenever you move the shoulder, there is a pain. The arc is painful. There can be localized discomfort. This is a deltoid muscle. The insertion of the deltoid muscle over here. Whenever the patient will be telling you that I'm suffering from shoulder pain, he will show, doctor, I'm having pain over here. If you just press the particular portion, you'll find tenderness over here. One of the very important symptom of frozen shoulder is nocturnal aggravation. The patient, whenever he will, even unintentionally turn on the affected side, his or her sleep will be broken. He will wake up from the sleep because of the pain, cannot lie on the affected side. This is very important. And mostly adults are affected, especially between 40 to 60 age, and females are more affected than males. And after this, certain time, maybe 6 months, 1 year, 1.5 years, the problems can, resolve on their own. So this is the way the frozen shoulder patient comes to us. In any stage, they can come to us. Now, managing these cases homeopathically. So I've covered the anatomy of the shoulder joint, especially the glenohumeral joint. I've covered the anatomy. I've covered the pathology, what happens in the frozen shoulder. Because if you know what happens in the frozen shoulder, then only you will be able to diagnose the case, and then only you will be able to move properly, what medicine to give, what are the symptoms that should be taken as a determinative symptom in that case. Now, there are some dictums which is very important to know. Now, frozen shoulder cases, these are all painful conditions. And in these painful conditions, non-surgical management is the most sought after method. Non-surgical method. People, they normally don't go for surgery in these cases. And even good doctors, they also don't advise for surgery in these cases. So non-surgical method. And out of this non-surgical method, nowadays I've seen that, patients, they have got a tendency to come to us because whenever they go to an orthopedic surgeon, they know that they will be getting some painkillers, some steroids, and the patients, they are well aware of the side effects, complications of the steroids, complications of the painkillers. So they prefer to come to a homeopath. They prefer to come to a qualified homeopath who knows about this thing, and we are the best persons to deal with these cases in frozen shoulder cases. And just remember one thing: not only medical management, but these cases should be also advised shoulder exercises. There are some certain exercises which should be advised to the patients. And at the same time, the comorbidities like thyroid problems, like diabetes mellitus, if they're associated, they should be managed. Even if there is some other pathology of the shoulder, like arthritis of the shoulder, they also should be managed along with the frozen shoulder problem. Now, in homeopathic management, we already know that in a disease, there are some common symptoms, there are some uncommon symptoms. We have already learned it from the first year. Now, in most of the cases, we know that common symptoms are not decisive. In this case also, we have to depend on the common symptoms to diagnose the case. We have to try to find out some uncommon symptoms, some extra symptoms which are beyond the scope of the common symptoms to diagnose our remedy. So, in most of the cases, common symptoms are not decisive. So, we have to look for the individualizing determinative symptoms. This particular term, being a teacher of repertory, I just tell you, determinative symptoms, this term was coined by Dr. Garth Gorik. If you go through the repertory chapter, Dr. Garth Gorik actually coined this term, determinative symptoms, which are uncommon symptoms actually. But just remember one thing, if determinative symptoms, uncommon symptoms are not found, then common symptoms, if they're very strongly present in the case, they can be determinative. They can be determinative. Common symptoms also can be determinative in a case if they're very strongly present, if they're very persistently present in that particular patient. Remember another thing, in these cases, remedy needs to be changed as the symptom changes because there are some series of problems, pain, gradual pain, stiffness, some other sensations. So if these things change, your remedy might be changed, need to be changed actually. And in this case, just remember, at least it is my own experience, mental symptoms are not so very important. Even if a person starts crying before you with frozen shoulder problems, I don't think pulsatilla will be or nectromy will be able to cure the case 100%. Maybe slightly it will help. So mental symptoms are not so important in these cases. And in the next slide, I will show you some of the local determinative symptoms. Now, this is a pictorial representation of the shoulder, and we have to mainly take the symptoms in the following form: location. Location means you will tell shoulder is the main location. No. Which side of the shoulder is affected? Right, left, or earlier it was right, now it is left. So contralateral involvement or even bilateral involvement. So this location is very important. And whether it's only located in the shoulder or it is radiating to the down to the deltoid or it is radiating down to the scapula, coming down to the chest, this radiation, this extension of symptoms is also very important. Sensations are the most important things. One of the most important indicators of selecting the remedy, sensations. Whether it's a heaviness, whether it's a burning, whether it's a whatever sticking type of pain, whatever be the pain, this is very important. Modalities, as you all know, that comprises the most important part of a symptom, whether the pain is aggravated by moving up, yeah, moving down, getting a shoulder backwards. This sort of modalities, especially the circumstantial modality, is very important in selecting the medicine. And concomitants. Concomitants means if there are other comorbidities, other symptoms associated, which is very commonly found, that can also be taken into account to select the remedies. Now you can ask me where to find these things, where to find the location, where to find the sensations, where to find the modalities. Please go through the repertories. In these cases, the repertories are the best guides. If you open the repertory, I'm having my repertory beside me. If you open the synthesis repertory or the complete repertory or any other repertory, go to the extremities chapter, open the pain rubric, and from the in the pain rubric you'll find shoulders. In that particular sub rubric section, you will find a lot of symptoms which you can use diagnostically for selecting the remedy for frozen shoulder. Now, I've given a few examples. I've given a few examples over here, locations and modalities in the following slides. If you go through the repertory, if you go through the Materia Medica, you will find this pain in the right shoulder. If you open the synthesis repertory, you will find a lot of medicines, but mostly calcarea, chelidonium, ferrometallicum, lyco, sanguinaria comes. Of this, I found sanguinaria to be specifically indicated for right-sided shoulder, frozen shoulder cases. Many doctors, they blindly give sanguinaria canadensis for right-sided frozen shoulder. Similarly, left shoulder also, there are some remedies which are coming very commonly. Ferrometallicum is one of them. Lidampal is one of them. Rastux is one of them. Even sulfur can come. So these things you can find from the repertory, and you have to, determine which drug is required. This is a very important symptom I have given here over here. Pain right shoulder, accompanied by pain in the left knee or the left leg. So diagonal pain. This is also an important location. Diagonal pain, if you find in a case, you can think of Asclepius tuberosa, a small remedy, but a very important remedy. Asclepius tuberosa. Even pain in the left shoulder affected at the same time with a pain in the right hip joint, right over here. Stiffness is also a very important part over here. Stiffness of the shoulders. You can think of calcareous sulf. You can think of Dulcamara. Gettysburg. Gettysburg is also a small remedy which is very important for this stiffening arthritic pain in frozen shoulder in small joint arthritis. Gettysburg is also very important. Phytoloca, Rustux, sanguinaria. Heaviness of the shoulder. There is also another sensation. Patients very often complain that I cannot lift my hand. I feel as if something, some load has been put over here. Even if I cannot put on my. So in these cases, Ferrometlicum, Natrium, pulsatile rustles, they can come. In heaviness of shoulder, sulfur is a very good drug. This is a symptom I have noted over here. Heaviness felt in the right shoulder, as if the coat is very heavy. Whenever you are wearing the coat, you cannot keep the coat on. Coat is feeling very heavy. These are all symptoms of frozen shoulder. And these are the peculiar things. These are the things that I'm trying to tell you that these are the peculiar things that will find out the right homeopathic remedy for you if you can, if you know how to utilize the repertoire. There are some other examples over here. Pain, shoulders, and abduction. This is abduction. Anatomically, this is when the arm moves away from the shoulder joint, moves away from the body. That is called abduction. So in abduction, in most of the repertories, interestingly, you will find chelidonium is only mentioned. In Kent's repertory, in Bogus repertory, in complete repertory, only chelidonium. In the synthesis repertory, I found, in addition to chelidonium, there's a mention of plutonium nitricum. Okay, plutonium nitricum, though, to be very honest, I haven't used it so far. I have used plutonium in case of hemorrhoids, but plutonium is mentioned in synthesis. Pain shoulders on raising the arms, pain shoulders, putting arm behind the back, impossible. So these are all the sensations, modalities, and location combined together, they form a determinative symptom for finding out the right remedy. Pain shoulder, this is another symptom. Pain shoulders, lifting or overlifting aggravation. Doctor, in my shop, I have to lift 20 liters of water, jars, and now I'm having pain over here. So that is the cause. That is the cause. That is the precipitating thing. After that, the patient is suffering from frozen shoulder. So these things, this history is very important. And from the history, you have to actually form the totality of symptom and you have to diagnose the case. Now, a few rubrics I'll just tell you because time is very short. It's already 4:40. In synthesis repertory, which is the most modern repertory we are having nowadays, I've just taken out some rubrics for you. There are some n number of rubrics which you can, correlate with frozen shoulder. In the extremities chapter, if you go for frozen shoulder, you can find out in inflammation, shoulders, periarthritis, synthesis, extremities chapter, pain is the rubric, shoulders, synthesis chapter, extremities, pain, shoulders, abducting arm aggravation, where you'll find chelidonium and plutonium nitricum, synthesis, external pain, shoulders, dislocated acid. This is a very good sensation. The patient will tell you, doctor, I think my hand has been dislocated. This is also a very important sensation you will find in the repertory. Repertory is very important. I can tell you from my own experience of teaching, from my own experience of using the repertory every time. And whoever has come to my clinic, they can see that always I keep my repertory beside me. So these are other rubrics: pain, shoulders, lying on the side, painful side aggravation, right-sided shoulder joint, frozen shoulder. I'm lying on the right side. I'm having pain. Then shoulders pain on raising the arm. Then another sensation over here: synthesis extremities stiffness. If you open the Murphy's repertory, which is also a very modern day repertory, complete repertory, this Murphy's repertory, if you go for frozen shoulder, you will find that he has actually mentioned stiffness of the shoulder as a cross reference for frozen shoulder. There is no separate rubric as frozen shoulder. He directs to go to the stiffness. So this is also very important. Stiffness of shoulders has to be taken if you repertory is the key. Heaviness of the shoulders. Sulfur is a very good drug. Heaviness. If you go through the complete repertory, you can find these are the rubrics almost similar to what we found in the synthesis repertory. Pain, shoulders, motion, aggravation backward, raising arms, abducting arms aggravation. You will find chelidonium over here only mentioned. Extremities, heaviness, shoulders, stiffness, shoulders. These are all. I told you whenever you are opening the repertory, you can find n number of rubrics which can be actually effective in finding the proper remedy for the case in hand. Now, glossary of materia medica. Everything should be accompanied by a materia medica glossary, whereby a few drugs I'll try to mention which are commonly coming, but don't stick to these things only. Bryony alba is one of the very good remedies for frozen shoulder, especially in the initial phase where you will find the pain is teaching in character. I told you Sensation is very important. Not only the pain, what type of pain, stitching pain, tearing pain, and slight movement of the hand. If it is an active movement or even it's a passive movement, the patient will, shout with pain. So this sort of stitching pain, tearing pain in the shoulder joint, which is aggravated by wrist motion, you can safely prescribe brine yerba. Though these are very common symptoms, but I told you when common symptoms are very strongly present in a case and you don't find any uncommon symptoms, you can go for this common symptoms also. Similarly, the opposite modalities if you get where the patient will tell you, in the morning when I wake up, I feel stiffness, I feel pain in the shoulder joint. But as the day progresses, as I start walking, gradually when I start walking, the pain gradually diminishes and the pain aggravates in the night time. So this sort of gradual motion amelioration, initial motion aggravation, you can think of Rustux. And there can be a history of overstretching or injury. Doctor, I fell down on the floor. I slept down on the floor, there was water on the floor. And after that, after certain time, I'm having pain in the shoulders. So this overstretching history is very important for us. Sanguinary canadensis, I told you, in some of the books you will find mentioned the right-sided frozen shoulder sanguinary canadensis is specific. But the main modality in this case is the pain will be worse at night time, will be worse when the patient goes to bed and cannot raise arm. So this time modality is very important for sanguinary canadensis. Even even you will find some of the doctors they are having a practice of giving sanguinaria and ruta alternatively. Sanguinaria and ruta, sanguinaria and guaiacum for these frozen shoulder cases. Okay. And sanguinaria patients, they will tell that the pain will be over this area, this deltoid area. This area is very, very painful. Sanicula is mentioned in the repertories, though I haven't personally used sanicula so far in frozen shoulder cases. But in sanicula, the main thing is the sensation that is burning sensation will be present. Burning sensation will be present, and whenever the patient will keep the hand like this, he will wake up with the pain. When he keeps the hand like this, he will wake up with the. So in these cases, you can think of sanicula. Ruta is very, very important for these joint disorders, whether it's frozen shoulder, whether it's arthritis, whether whatever be the case. When the ligaments are involved, you have to think about ruta graveolens. Almost especially, I told you that there are some doctors who are having the habit of prescribing sanguinary and ruta in right-sided cases. Sorry, ferrum metallicum and ruta in cases of left-sided frozen shoulder cases. Now, in ruta, you will find there's a wrenching pain, as if the pain is actually going inside, wrenching pain when the arms are hung down. When the arms are hung down like this, they will feel the pain over here. That is not very common in these cases. Guaiacum is also another very specific remedy where there is immovable stiffness. Where there is immovable stiffness. The stiffness itself is an indicator of Guaiacum. And there in Guaiacum also you will find a history. Relief by cold application and aggravation by warm application. Just the opposite of Rustux. Rustux is also having stiffness, but the pain, the stiffness will be relieved by warm application. In Guaiacum, the stiffness will be relieved by cold application, aggravated by warm application. Ferrometlicum is a very specific drug for frozen shoulder, especially in left-sided shoulder affections, where there is a shooting pain, tearing pain, and that pain comes down in the arm. And there will be a paralytic pain, as if he cannot move the hand. There's a paralytic feeling in the hands. Cannot put the hand behind the back. If you ask him to, scratch the back, he or she will not be able to scratch the back. And with slow movement, gradual movement, it will be better. Chelidonium, you'll find in the repertoire chelidonium right-sided shoulder pain, where mostly infraclavicular area is involved. Not only the shoulder area, but the infraclavicular in the back, down in the back, in the clavicular region, you will find the patient will tell you that this is the area where the pain is a maximum. And there will be immobility, inability to move the shoulder. So right-sided shoulder joint, where maximum pain is in the clavicular portion, think of chelidonium images. Meserium, severe pain, what's at night, cold intolerance. Meserium is a very good neurologic remedy, remember it. And sulfur can come in two ways when there is a heaviness sensation persisting in the shoulder joint. And to complete the cure of shoulder joint, you can think of sulfur. So, sulfur also can come in acute cases of frozen shoulder, as also in completing the cure for frozen shoulder. Sulfur is also a very good drug. So, it can be given in the thawing phase of frozen shoulder. Asclepias tuberosa, I told you, it's a very good remedy where the pain is diagonal and the pain involves the chest muscle too. Not only the shoulder joint, but the chest muscle also will be involved. Another remedy is very important, which we very often miss. in frozen shoulder, that is thiocinaminum. SBL company specifically prepares thiocinaminum 3x tablets. They can be given as a single remedy or they can be given in association with the main remedy just to reduce the adhesion, just to reduce the scars, just to reduce the stiffness of the joints. So you can think of thiocinaminum as a single remedy or as an associated remedy to the main remedy. This is a very good drug. I will give just two cases and I will finish. One female, 69 years, she came to me with this problem: pain and stiffness of the left shoulder, cannot raise the hand laterally, cannot extend the hand backward. Common symptoms: pain extending from the left shoulder down to the left hand and up to the fingers. This radiation is very important. Wakes from sleep at night if she moves her hand. Suddenly moving the hand and she wakes up. Mostly common symptoms. These are mostly common symptoms. But when I asked or when I saw the case, the maximum importance was on the pain being aggravated by slight movement. Slightest movement, and there was aggravation of the pain, and the patient cannot sleep at night. So the diagnosis was clear from the history. The drug is very, she was not having any diabetes, she was non-hypertensive, she was not having any thyroid problems, no history of or antecedent history of any disease or injury. So the prescription was Bryony Alba 200, and she was asked to do exercises. She was shown the exercises, and she was doing the exercise. After 1 month, she came. The pain was better. It was not gone totally. And the dominant symptom right now was the radiation of the pain. She told me now the pain is less over here, but the whole hand is affected. So this radiation. So I told you that remedy needs to be changed. When the symptoms change, you need to change the remedies. So now the radiation is the most dominating symptom. And after getting this symptom, I prescribed Calmialac 200. And associated with that, I gave Boswellia mother also. The Boswellia mother is also very good for this painful adhesive type of conditions. And she was told to undergo exercises. 2 months later, these are the rubrics. In the left side, I have written the rubrics. 2 months later, when she came, she was better. Her husband told me that now, what happens, she's whole day she's better. Whenever she's lying in the night, whenever accidentally she turns on the affected side, she wakes up from the sleep. So now she cannot lie on the painful side. That is the main dominating symptom. So I gave Sanguinaria canadensis because there was some burning, I think, also. Sanguinaria canadensis, and the penultimate report was just, I think, a month or 2 months back when she was feeling better. There was partial stiffness, which was maximum in the morning time, and that was better by exercise. So you see, these symptoms are changing, and I completed the case with Rustux when the pain is reducing, when you think that now you have almost covered up the case, you can think of giving Rustux. In the repertory, Colosins was coming, Rustux was coming. I preferred Rustux. Now, I got the report from the family members that she is well now. This was the first case. Now, what is the inference from this case? Totality is usually based on presenting symptoms. Whatever presenting symptoms the patient will present before you, that is the totality. Determinative symptoms can be common, should be very dominating. It can be a common symptom, but it should be very persistently present, very strongly present. And dominating symptoms change from time to time. Accordingly, medicines should be changed. Another case, can I take another 2 to 3 minutes, Dr. Manju? Okay. So this is the last case, 65 years old lady, pain and stiffness of the right shoulder for the last 7 months. So she is almost in the frozen stage. Aggravation by abducting the hand, motion, turning to sides, and gradual movement is relieving. Pain in shoulder disturbing sleep on turning to the painful side. Whenever she's lying on the painful side, her gets disturbed. And there was associated pain in the left leg. I told you that only frozen shoulder cases can come. They can come with other also painful conditions. So this patient was having pain in the left leg, including the left knee. There was osteoarthritis of the left knee. So diagonal pain was present. There was comorbidity of hypertension, diabetes mellitus of the right shoulder was very, very painful. X-ray was done, nothing was found. X-ray of the knee was done, there was osteoarthritis of the knee. So diagnosis, frozen shoulder of the right joint associated with osteoarthritis of the left knee. This was a small, short, repetition that I did. And the first drug that was coming was Asclepius tuberosa. Though the figures are only 1, 1, 1, 1, 1, but they are very important. So don't go only by the board symptoms. The third grade symptoms are also very important if they're clinically important. So Asclepius tuberosa was given. Asclepius Materia Medica was like this: rheumatic pains. If you go through the Materia Medica, Rheumatic pains, sharp stitching and diagonal in nature. Diagonal in nature, rheumatic joints give sensation as if the adhesions being broken up. Whenever the patient will be moving that particular affected joint, he or she will be having a sensation as if the joint is getting dislocated. So this adhesion being broken up is a very important sensation of Asclepius tuberosa. Asclepius tuber, and before coming, why did I give Asclepius more so? Because before coming to me, she took Rustux, she took Brania, she took other drugs also. So this thing also you have to keep in your mind. You don't repeat the same mistake. So I have to think out of the box. So I have to go for some rare drug, and I gave Asclepius tuberosa along with thiocyanamide 3x tablets. Patient's daughter reported 2 months later. This case actually responded very fast. She stays around 200 kilometers from my place, and second time she didn't come. Her daughter came to me. She told me that her mother is very fine. Just repeat the medicines. And now she is without the medicines for this frozen shoulder. Now the shoulder movement is normal. Now she is only taking medicines for the osteoarthritis of the knee. Now, what is the inference? This is the last slide. The inference from this case is history of previous intake of drugs is very, very important. Don't make the same mistakes. Don't repeat the same medicines. Repertorization might help to find the required remedy. Don't neglect the repertory. And you can add some other trituration or mother tinctures with your main medicines so that the recovery can be speeded up. So, final conclusion, homeopathy helps considerably in resolving cases of frozen shoulder, whatever be the case. If it's an initial case, if it is a long-standing case, whatever be the stage of the case, you can confidently deal with frozen shoulder cases. And after this, today's webinar, I am quite confident that all of you will be able to diagnose the cases and treat in a clinic, and glorify the flag of homeopathy in the future. Thank you all for your patient hearing. Thank you, Dr. Manju. Over to you.
Thank you, sir, for this informative presentation, and I'm sure this will be helpful. So now we are moving towards our question and answer session. So I'm having a one question that is it necessary to have a physiotherapy session along with homeopathic treatment, as this is the main mode of treatment in allopathy, which most of the assessed treatment for common man?
Shall I answer now?
Yes, yes.
Yeah, yeah. Physiotherapy is definitely important because exercises are a part and parcel of the treatment. And if you are knowing a good physiotherapist, because nowadays a lot of physiotherapists are roaming around us who are not qualified. So you have to advise for a good qualified physiotherapist, and you can take the help of a physiotherapist.
Hmm.
Definitely.
Right. So the next question is, a frozen shoulder progresses through different stages, freezing, frozen, thawing. Do homeopathic remedies change for each stage?
Please repeat it. Please repeat it.
As frozen shoulder progresses through different stages, do homeopathic remedies change for each stage?
Yeah, definitely.
Yes.
It's for
As
the
per
it's
the
for the
symptoms.
it's for the actual symptoms that are present in that particular stage. Even
Hmm.
freezing frozen stage, they can be overlapping. They can be
Right.
overlapping. But the actual symptoms you have to find out. What is the location? What is the sensation? What is the modality? Now you have to think homeopathically. Okay,
So
and
the
then you have
next
to select
question
that.
is, can I ask?
Yeah,
So
yeah,
the
sure.
next question is, sir, how we cured a diabetic patient who has frozen shoulder as well as a rotator cuff injury suggests best remedy.
Actually, you have to diagnose whether it's a case of frozen
Yes.
shoulder or rotator cuff. I told you the differential diagnosis between the two is that in frozen shoulder cases, they are having an insidious history. They are having insidious history. That is, you should not find a immediate history of injury. In rotator cuff cases, normally the cases starts abruptly. Almost in most of the cases, the symptom starts abruptly. Number two, in frozen shoulder cases, I told you that passive movement and active motion both are lost. In rotator cuff injuries, mostly the active motion is lost. Passive motion is not lost. So first you have to diagnose whether it's a case of frozen shoulder, whether it's a case of rotator cuff. And in rotator cuff also you can go for an MRI to get it, diagnosed whether it's a case of rotator cuff. And then I'll tell you the same thing. You go for the symptoms, you go for the sensations, you go for the modality, and select the remedy. And in these cases, I think for these tearful cases, you can take help of some other tinctures like symphytum, like ruta, and with the main medicine. I think that will actually help us in expediting the cases recovery.
Hmm. Next is, some cases comes where patient have undergone steroid injections or are under steroid therapy or surgery. How does homeopathy support tissue healing and mobility recovery?
most of the cases come after steroid injections. Most of the, and you have to take it as a fresh case because steroid injections, they have got a, half life. After 3 months, after 4 months, the symptoms, they again recur. So you have to take it as a fresh case. You don't just keep in your mind that this case was taking steroid. It is a better case. You can actually convince the patient that don't go for allopathy right now, because some of the patients, they are keeping their both of their legs in two boats. If they are having pain, they will take some painkillers. But in these cases, you can be very sure that they are not going to take the steroids anymore because they haven't got the relief. So take this as a fresh case, start it as a fresh case, and go for the treatment.
Next is Rustox is effective medicine for frozen shoulder.
No, actually, you should not take it as a specific remedy.
Right.
You should go for the modalities. If there is no the not the modality, but there is the gradual movement emulation. If you don't find the modality, please don't go for Astax. It won't help.
Mm.
If you see that the case is getting relieved by cold application, don't go for Astax. There might be stiffness, but I told you that in those cases, if there is relief from cold application, aggression warm application, think of Guecam, not Astax. So always go for the sensation. Always go for the modalities. We are having
Symptom
very good
basis.
things in the repertory.
Mm. Next is, are there any homeopathic remedies that can be used as a prophylactic in high risk individuals? Example, diabetic, thyroid dysfunction, postmenopausal women to prevent frozen shoulder.
I don't think so. I don't
I
think so.
recently, okay, this is related to SBL. Now the next is, will restricted movement of upper limbs, unilateral or bilateral without history of injury always count under frozen shoulder?
No,
Hmm.
it can be a case of shoulder arthritis also. It can be a case of shoulder arthritis. You can diagnose the case simply by doing a X-ray or an MRI. The symptoms will be the
Next
same. The
is,
presenting the symptoms will be the same, but you have to
okay.
diagnose according to the progression of the case.
Next is for frozen shoulder cases with a long standing stiffness. Is an LM potency better than centesimal potency for deep action?
I prefer normally centesimal potencies or decimal potencies.
Okay. And
This is this
I
is
think
this is specifically my own experience.
yeah.
Okay.
So I think this will be the last question. Should we also differentiate frozen shoulder with cervical radiculopathy and shoulder impingement for selection of homeopathy remedy, or go with the presenting symptoms and decisive symptoms?
No, diagnosis is very important for advising the exercises, for imposing the restrictions of movements or anything like that. But I think symptoms will have to be taken whether it's a frozen shoulder case or a cervical spondylitis.
Hmm.
The symptoms will be merging. We have to take the sensations, modalities, locations, the radiating, the radiculopathy. But diagnosis is very important. You have to advise accordingly.
So basically, we need to diagnose the case and the main symptoms of the patient, what the symptoms are presented by the patient. This is very important. So we will not go with all the medicine that this is a specific medicine for
Obviously.
this problem, right? So I think we have to advise that please select your medicine on the individual basis and on the symptom basis of this frozen shoulder.
Dominating symptoms, right?
Yeah. So now we are moving forward with our three best selected questions or the name of the viewers. So the first name is Prerna, second is Dr. Anil Sharma, and third is Adish Kadam. So I'm requesting all of you please send or share your contact number on this question and answer chat so that we can connect you. And thank you everyone, and thank you sir for giving this presentation. And I'm sure everyone will be aware about frozen shoulder thing. Yeah. So thank you everyone.
Okay. Thank you. Have a good day.